According to Colorado mental health data, 1 in 10 people in our state are living with an eating disorder. And now 2 bills aimed at improving care and prevention are officially law. KRDO News Channel 13's Natasha Lynn explains the bills and the state's goal of helping people recover.
The goal of the bills is to remove barriers that some people with eating disorders experience when trying to seek treatment. The largest of which is people who are denied treatment due to their body mass index. Eating disorders are serious mental health conditions. They have the highest mortality rate of all psychiatric illnesses, and the number of people being treated since the pandemic is on the rise.
Eating disorders thrive in secrecy and isolation and removing people from their community and in-person events and just everything that happened since 2020. I think we saw what was it, a 1,000% increase in our support group attendance since the start of COVID.
Senate Bill 23-176 removes body mass index and any other weight standard as a factor that can be a determination to insurance costs for patients.
The biggest thing with removing BMI as a barrier is not only will it allow folks to have better access to treatment and more likely to get into treatment, but also stay into treatment longer and for as long as they need. So I think we hear a lot from our community members that they go into treatment and then insurance cuts out because their BMI isn't at the range that insurance deems as sick.
While a low BMI can be an indicator of some eating disorders, less than 6% of people with eating disorders are considered medically underweight.
So it just kind of pulls it back into being like, okay, eating disorders are not just about the way a body looks and about a weight and how much or how little people eat. It's very much about the internal workings of each individual.
Eating disorders can be referred to as a coping mechanism. So treatment and recovery looks very different from person to person.
It really allows us to have an emphasis on the mental health components of eating disorders, which is primarily what eating disorders are about. It's rarely about the food. It's about everything that's happening inside your mind and control. And there's a lot of co-occurring diagnoses with like trauma and substance use and
depression, anxiety,
isolation, all of that.
Doctors remind everyone that eating disorders can affect people of all ages, but they're optimistic that this will help everybody get the treatment that they need. In the newsroom, I'm Natasha Lynn for KRDO News Channel 13.